Yeah, a couple is, these are general and they're not really about this current dilemma, but I'll throw them at you anyway. What is the risk of mixing with unvaccinated primary school children if we have low or no antibodies? That's from a lady who I know worked in a primary school and has been furloughed and active monitoring and shielding all these months. Leslie asks, are there any plans for a fourth dose 8 weeks after the third dose if someone still has no antibodies? Apparently this is happening in the USA and looks like it's being beneficial for some. I've not heard of that, have you?
No, I haven't heard that they're going to do that here. No.
Okay. What is the risk of using, this is the one I told you about, what is the risk of using public transport after 3 doses while on rituximab maintenance after BNR, but on antibody testing you have none? Well, I was going to ask you about this whole rituximab thing anyway, because our bodies can't take some of these vaccines for 6 to 9 to 12 months after rituximab anyway. Is that correct?
Much less likely to respond to them from an antibody perspective, yes. I mean, there's a lot to unpick there, because I guess for a start, we don't advise that patients with WM have rituximab maintenance. There hasn't been any data to conclusively prove that it's of use anyway. I mean,
I happen to know that this lady is on rituximab maintenance after.
So, but it's not necessarily something that we would routinely recommend.
No, okay, all right.
But but I'm going to stay away from discussing that, because obviously that's an individual decision with the clinician, and yeah.
Okay, well then what I will ask you then is, because
but more generally about being on rituximab and antibody therapy, yeah.
Yeah, good, okay, that's it, yeah, okay. And then, so yeah, I don't want to keep you too long. I'll introduce you. I'm assuming that the people who have easily gone and got their third vaccines and are all okay, they're not going to be on this format today anyway. I think most of the people, I'm looking at the names, there's 16 on there. They're all people that have got in touch with me recently about this whole thing. So, and I don't propose taking any questions. I might take 1 or 2 if you're happy, but only if they're questions that we haven't covered in our talk.
Yeah. So if it's okay with you, I might just start by saying where I think we're at with things and what they should be doing. Yeah. And then if you think there's anything that I haven't covered, then ask me questions.
I think you should, because, you know, as I said to you earlier, I've been Mr. Angry last week, going to war with my GP surgery. But you've got a different view on that, and that's fine. And if you express that view, that might shut a few people up who have the same view as me. It's just that going back between the GP and the 119 hotline, and both of those agencies saying, no, we're not doing bookings for third vaccines, you can have a booster.
Yeah.
And so anyway, that's what a lot of people are suffering from, I think. Yeah. Okay, so we've got 20 people waiting, and I know that a lot of people have told me they can't break away for lunch, you know, for this time. So it's being recorded. You're happy with that?
Yeah, that's fine.
Yeah. Being recorded, and they can watch it tonight at their leisure. So I'm going to start admitting people. I'm going to try and get everybody on mute, because I don't want any dogs barking or phone ringing. Mute all current. Oh, shit.
Morning all.
Morning.
You put yourselves on mute if you're not on mute, guys. Thank you very much. And Dima, I've put you on mute, and I didn't mean to. Hold on, I've got to find you.
You've allowed me to unmute myself.
Okay, that's good. That would have been a bit embarrassing, wouldn't it? So a couple more coming in. Well, the CEO's coming in, that's good. Okay, well, I'm going to start then, Dima, because it's 12 o'clock, and if anybody joins, I'll let them in and try and make sure they're on mute. So good. So welcome everybody to our what I've called an emergency webinar, because this was raising lots of questions last week, and many of us were having problems over this whole third vaccine situation. And Dima El-Shakawi, as most of you know, is a consultant neurologist and one of our trustees and a WM expert, is joining us in her own time, which we're very grateful for, just to cover some of the issues, maybe concerns that we've got. I've got some questions I'm going to put to her at the end, but I'm hoping she's going to cover most of those in her talk anyway. We don't want to keep her too long. We are talking only about this third dose, so not asking too many questions overall about COVID and the whole history of COVID. It's about this whole third dose thing. So Dima, thank you so much for joining us, and I'll hand over to you.
Thank you, Bob. Hello, everyone. Very briefly going to talk about how I've interpreted all the information, or lack of information, shall we say, that's come from the government regarding third doses. And I like to keep things very simple for myself, but hopefully that'll make it simple for you. So going to cover who, what, when, and where. So just to be absolutely clear, we're talking here about third doses, so part of your primary vaccination schedule, as opposed to boosters. So in terms of who's entitled to third vaccines, I would say that anyone who's on this call, assuming that you are the person with WM rather than a carer or a relative, would be eligible for it, because it's anyone that was immunosuppressed at the time of either their first or second or both vaccinations. And I would say, given that you've got WM, and that whether you've had therapy for it or not is not a curable condition, that you were by definition immunosuppressed at the time of your first or second vaccination. So I would say that anyone with WM is entitled to a third vaccine. That is regardless of whether you've had an antibody test and whether that antibody test is positive or negative, because as we have briefly talked about before, antibodies aren't the only thing that the vaccination kind of stimulates, and we don't really know what impact the WM has on your ability to mount other types of immune response. So it's separate to whether you've had an antibody test, and regardless of the result, I would say anyone with WM is entitled to a third vaccination. So that covers the who. The what, and I've put what and what dose. Currently, the government have said that regardless of what vaccination you had the first time round, so whether it be Pfizer or AstraZeneca, everyone for the third vaccination is going to be having either Pfizer or Moderna. As far as I understand, but please correct me if I'm wrong, if some of you have been offered something else already, that at the moment, most places are only offering Pfizer, that Moderna isn't in general use yet, but that it will be in the near future. So the whole question about dosing and half dosing doesn't really apply for Pfizer, because technically it's the same dose, whether you're having it as a booster as opposed to the third vaccination. So it's the same thing. If they offer you a Pfizer booster, I would take it. And it's just about the wording, which can be corrected later on, which we'll come on to in a sec. So don't worry too much about the dosing. The only time that the dosing becomes an issue, whether it's where it makes a difference, whether it's a booster or a third vaccine, is if you're offered the Moderna vaccine, where I understand the Moderna vaccine, the booster is half dose, but I would ignore all of that if you're offered Pfizer, which I understand is what everyone's being offered. Well, I can see some shaking of heads, but we'll come on to how to get it in a sec. In terms of when, I know that some of my patients that have gone to GPs have kind of confused the whole third vaccine versus booster, and they've been told they have to wait 6 months before having their third vaccine. But because this is a third vaccine as opposed to a booster, the government advice is just waiting 8 weeks. So the same gap as you had between the first and the second. So as long as there's been at least 8 weeks since your second vaccination, you are entitled to the third one. And then in terms of where, and I think this is where we're getting into problems. The government did say and issued advice both to GPs and to NHS trusts that actually the third vaccines should be offered by the NH trust that's looking after you, which is different to the first and second, where most people were getting it from their GP. So for example, I work at the Royal Marsden, as Bob mentioned, we weren't routinely giving everyone their first and second vaccinations for our patients, but we are offering our patients their third vaccination. If your hospital is not offering it to you, then you need, and you're getting problems with your GP, then what I would advise is to go to your hematologist and ask them for a letter. If they can't offer you the vaccination, they need to offer you a letter that you can then give to your GP in support of you having the third vaccine. And I'm going to put, I've started copying it, but let me put in the chat there a link, and this was what was the official thing that was given to all NHS trusts, saying that it should be the trust that's giving the third vaccination. Now, you may say, well, what does it really make that much difference, seeing most of us are over 6 months since our second vaccine, whether we call this the third or the booster, if I'm telling you that actually it's the same vaccination, regardless of how we label it. Where it may come into a difference is then whether you'll be entitled to a booster 6 months following the third vaccine. So that would then mean that your booster is your fourth vaccination. The JCVI, which are the advisory group that advise the government, have said that that is what they expect they will do, but they haven't absolutely said that that's going to be definitely the case. But I suspect that that's what they will do. But they're going to look at data as it comes out over the next few months before making a final decision on that. But that's why it's important that the wording and how it's recorded is correct, because you may then still, or the likelihood is that you will still get a booster 6 months after the third vaccination. So from my reading of all the paperwork is that actually the difference here, and where some of the confusion has come, is that the onus is on the NHS trust to identify patients and to offer them the third vaccine, rather than your primary care, which is your GP. So I would say if you're having problems with the GP, I wouldn't, and many GPs are being very proactive. So we've got lots of patients who've already had it at their GP, no problem. So, but if you're getting problems with your GP, then I would say go back to your hematologist and ask them, are they offering it? And if not, that you need a letter from your hematologist. I think that's all I wanted to say.
Okay, Dima, thanks for that. I've got a couple of questions for you then.
Yes.
One is about rituximab.
Yeah.
So those of us who have either just finished BNR treatment, or some of us who are on rituximab maintenance, is there any point even in getting a third jab? Because we believe, don't we, that for the first 6 months or so after rituximab, that the jab isn't working very well.
So I would say that this comes on to when to have the vaccination, and that it's difficult to make a blanket statement for anyone on antibody therapy. I'd say that if you're close to finishing it, then maybe waiting a month or two may be the right thing to do, but it's kind of weighing up and balancing that, delaying it versus just having it now, even though it may be less effective, but that actually it may be still affording you some protection. Like we talked about at my last webinar, that our ability to test people's abilities to respond to vaccinations is quite rudimentary, and antibodies is just one part of it. So although you're much less likely to respond and develop an antibody response to vaccinations, you're absolutely right on rituximab or other monoclonal antibodies that target the B lymphocytes. that there may still be other responses that are beneficial as well, such as your T-cell response, which we don't really test for outside research settings. So it's not something that can be routinely tested for. So I would say talk to your clinician about it. They may delay starting therapy, for example, if there's no urgency in starting for you to have your third vaccine before you start the therapy. They may, if you're close to finishing, decide actually it's better for you to wait a bit. But actually, if you're right in the middle and you've got a number of months left still of your treatment, that probably the benefits of having the vaccination as opposed to not having and just waiting a few months probably tips to just having the vaccination now.
Okay, thanks. And certainly one of the ladies who asked that question was, she's just finished her 5th session. She's got one more session of BNR to go. So
I mean, in that situation, it may be worth waiting a couple of months to have it, just to give it a bit more of a chance to work. I realize that, as you say, the data is kind of for 6 months after it's less likely to work, but it's not kind of a binary thing. When we report on trials and research, most clinicians or people that are writing the papers will have to put a cutoff, but it's not like before 6 months you're not going to get any response, and after 6 months that's it, it's fine. There's probably a continuum that you'll probably get more likely to get a response the further away you are from treatment.
A kind of a generalized thing that people are asking, and I'm not really sure it's relevant to the subject matter of this particular webinar, but it involves, even if we've had our 3 jabs, what about if we work in a school or we go on the bus to work, or we use the public transport? I guess you're going to say it's just a question of maintaining our vigilance, like you told us about before.
Yeah, it is. I mean, whatever we say, whether you've got antibodies, whether you haven't got antibodies, you're still going to be exposed to COVID, and it's about trying to be cautious and minimizing that risk. But where people will see as what's acceptable risk and what's not is different for different people. So we've got lots of patients that are quite happy to go on public transport and carry on their daily lives, and other people who are adopting a much more cautious approach. And I can't say one way is the right or not, because if you're exposed to COVID, then there is that risk. Okay,
thanks. Have you got time for just a couple of questions, Dima?
Of course.
Good. Okay, guys, if any of you got questions, but I want to be strict here, and I can see Sally, you're first up, but I want to be very strict. It's got to be about this whole 3rd dose thing. That we're not talking general WM or general COVID. So, Sally.
Okay, thanks. I've spent a month being at it backwards and forwards between my specialist and my surgery, despite the fact that the nurse in the surgery who gave me my flu jab knew all about 3rd doses, but and people losing letters and claiming they hadn't seen them, etc., etc. I have now very grudgingly, been told that I can change my booster jab, which is scheduled for this Thursday, to a 3rd dose with a booster scheduled for 6 months later, but they can only offer me AstraZeneca. They said I'd got to have AstraZeneca because that's what I had for my 1st and 2nd dose. So do I accept that, or do I then go back to my specialist and say, no, I can't get Pfizer there, where do I go?
So I think the data with the boosters and the 3rd vaccines are all with Pfizer and Moderna, which is why the government have offered those. So I'm surprised that they're offering AstraZeneca. I would say that I assume that AstraZeneca would still be fine and still offer extra protection, because we know that patients with WM way before COVID have less likelihood of responding to vaccinations, so that we often suggest slightly different vaccination schedules or increase vaccinations just to kind of increase the level of exposure to increase your chances of responding to the vaccine. So I think that going for a 3rd AstraZeneca would be better than nothing, but they should be offering you Pfizer or Moderna. Now, how much will and fight you still have to make that happen is kind of up to you, but that's what they should be offering. So I think you are entitled to go back, and I think you should be going back to your hematologist to ask them, because the trusts are the ones that are supposed to be offering these.
Okay, thanks. And Sally, it was Sally that asked me that question. I spoke to you about that earlier, Demas.
Yeah.
But it was Sally. So Tom, you were next up.
Yeah, thanks. You say about it's up to the trust. Well, I live in Buckinghamshire,
Yeah.
so obviously my trust is there, but I'm treated at UCLH in London.
So it's your hematologist looking after you, I should say.
Right. Okay.
So, I mean, obviously you may not want to go all the way into UCH, and a lot of you are probably having phone appointments where you don't need to go face to face. So if the trust can't offer it to you, or it's difficult for you to get in there, or actually less safe for you to go there, then they can offer a letter for you to take to your GP, and then your GP could offer it. And that's what the GPs have been asked to do, that if the trust can't offer it to them, then the GPs should be able to then provide it.
I've actually had mine by another route, but actually UCLH said they weren't writing to GPs about it. It's fine. I'm fine.
I would say but that is.
I was just interested in the answer to the question, because it might apply to other people as well.
Yeah,
that was my
and
concern.
Also it's a good.
Thank you.
It's a good point, actually. That I think we're adopting a similar thing, that we're not routinely writing to all GPs to say that they should offer the third dose, because we're contacting patients directly and we're doing it that way around. But I would say, as with everything, it is, and I'm sure that this is a self-selecting bunch of people, that you're all quite proactive anyway, I'm assuming, by the fact that you've joined this webinar. So I'm probably preaching to the converted, but always wise to be proactive about these things and ask for it, because we're all under a lot of pressure, and I have to confess that my heart sank when I saw the letter saying that we're going to have to identify all the patients that would be entitled to the third vaccine, because it's a lot of extra work on top of all the extra work that we're doing anyway. So it's always best to be proactive, because I think trusts are under a lot of pressure at the moment, dealing with inpatients and outpatients, to be able to do all of this. So if you haven't had a vaccine or been offered it by anyone, then go to your hematologist and ask them, can you get us either have it there or a letter of support?
And John Green, you're next, and then John Goodfellow, you're next after that with your typed question. So John Green.
Thanks, Bob. This is a bit of general information. I started my DRC treatment on the 11th of October. Prior to that, 2 weeks prior to that, I had the third primary dose. However, one of the major issues is the total confusion over what is meant by third primary and booster. A lot of people are saying that the booster is equivalent to a single dose Pfizer, which is correct, but also it's equivalent to half strength Moderna, which causes confusion for a lot of people. When I went to have my third vaccine, and in fairness to all the medical staff, they had not been briefed about the third primary dose. So when I went to have my jab, the computer system that was operated at the time didn't allow for the record of a third primary dose. And that caused confusion for the medical staff, the admin staff. So what they've had to do is to identify it as a third booster, as a booster, but in the comments column, add that it's a third primary dose. And I think that's one of the confusing aspects. It's not being explicitly stated in really simple words, the difference between a third primary dose and the booster dose. Now, things may have changed, but that caused a lot of confusion for the medical staff, apart from myself, who had to battle away to tell people that I needed a primary dose, not a booster dose. So I think that needs to be addressed.
I think you're absolutely right. And thank you for bringing that point up, that in the literature, and I'm trying to see if it's in that letter that I linked to, but I don't think it was in that letter, but somewhere along it, it did say in some of the literature that they'd given that the computer program that they used to record the vaccinations didn't have in their drop-down menu third primary dose. So what they had specifically said was that what happened in your case, which they discovered firsthand or experienced with you, was that they just to record it for now, and I'm assuming the computer program has been corrected to allow for it now, but that to record it as a booster, but then it will later on be changed to primary vaccination. Now, who's going to do that? I don't know, and that might be something else that will need to be you may need to be proactive on changing it. But at the moment, yeah, in terms of the actual vaccination, like I said, as far as I understand, Moderna hasn't been offered yet. So it doesn't make a difference to the actual vaccine that's offered. But from what I understand, Moderna will be offered very soon, that it will make a difference as to the dose of vaccine for that. But for Pfizer, the actual vaccine itself, it's the same dose. So you're effectively having the same thing. We're just calling it something different, which will therefore mean then that you'll be entitled to the booster later on, assuming that they do agree to the booster for people who've had a third primary dose.
Thanks for that, Dima. And John Goodfellow has just agreed with me that you've just answered his question as well. For what it's worth, on Saturday, I actually watched the lady type in onto my record that in the comments section that it was my third primary dose, not a booster. And I watched her type it in. So hopefully that will mean I'll get a call in 6 months' time. So I think it was normal calling.
I think someone's saying that maybe it has been corrected on the computer system, because when they had it, they were recorded as a third dose.
Yeah. Okay, good, lovely. So I can't see any more hands up. We've taken up a considerable amount of Dima's valuable time. Does anybody have any last questions?
And I will stay on just to find the letter that they sent to the GPs, just to put the link to that as well, so that you can see that too.
Is that the letter dated the 28th of September?
So there was one that they'd sent to NHS trusts, and there's one that they've sent to GPs. I'm assuming they were the same date, yes.
23rd of September, 28th of September rings a bell to me. I did have it here, but I've lost it.
So I'll put the link to both of them.
Okay, thank you.
And hopefully we'll see lots of you at the summit very soon.
Yes, and don't forget, Dima will be talking to us again about more COVID stuff at the summit, but she's going to add a little bit on about shingles and flu and all the other stuff we can get jabbed up.
More of a general vaccination talk.
Yeah.
Okay.
So good. So Dima's going to do that. She's going to be typing. So guys, thank you so much for joining us today. I hope you got something from that. I hope you've learned something. I hope you had many of your concerns answered. I certainly have. I told you all about my battle. I went to war with my surgery and I won, but it would appear I didn't actually have to go to war with my surgery, but never mind. I'll go in and apologise one day. So let's just wait for Dima to throw that stuff up. Anybody want to ask me anything? No, got, I don't know if it affects any of you. We've got 2 support groups tonight. We got the Wales support group. I think that is Robert. I think I saw him on it just now. And also a supporters support group for those of you who live with somebody with WM. So looking forward to those. And we've got an East Anglia support group tomorrow night. So the support groups are going well. And I would just back up what Dima said. The 4 of us at WM UK, Jane, Joe, Kat and myself, are all getting a bit twitchy because the low numbers of people registering for our patient doctor summit. So please, if you haven't registered and if you're interested in joining us for the day, please register. It's going to be a good day. There's going to be something for everybody. We're focusing it this year on less science and more patient, it being more patient driven. So we've actually got patients being interviewed and talking about living with WM. Got some nurses coming on, so it's going to be a good day with and not too science heavy. So if you haven't registered, please do so. So it looks like Dima is putting those on. Yeah, there's 2 there. Can you all see those in your chat box? I hope you can. Yeah, good. Well, I'll leave this line open then for you to copy those if you want to. Dima, have you disappeared?
No, I just didn't want you all to
No.
see me squinting as I.
You should go and see an optician.
Yeah, whilst I was finding the right things.
That's another
I'm
thing. Yeah, go on. Now, that's another thing. I've been asked to do a webinar on the eye and Waldenstrom's, so I'm setting that up at the moment. So that's something else coming along. And don't forget, guys, if you want a webinar about anything, I think they've been very successful, our webinars through the summer, and we're keen to continue them if you guys are going to watch them. So if there's a subject that we haven't covered, just drop me an email. Most of you know my address, bob.perry@wmuk.org.uk, and see if I can set one up. We've got one on the eye, and I'm trying to jack one up on fatigue, living with the fatigue of Waldenstrom's. So that's another one that's in the pipeline. Good. So if nobody's got any questions or anything to say, I will say goodbye to you all. Thanks for joining us today. Hope you've all got something out of it.